Hello, this is Dr. Charles Nemiroff, Chair of the Department of Psychiatry and Behavioral Sciences at the Emory University School of Medicine in Atlanta, Georgia. Today I'd like to talk to you about a recent, very exciting report that was published in the June issue of the Archives of General Psychiatry by Ronald Kessler, a professor at Harvard University and one of the leading epidemiologists in the field of psychiatry today. Many of you know Dr. Kessler's work because he was the lead investigator in the National Comorbidity Study. This was a study that sought to determine the prevalence rate of psychiatric disorders in the general population. And it was from these seminal studies conducted a few years ago that we really, for the first time since the older epidemiological catchment area study conducted many years ago, that we could get a handle on the high prevalence rate of mood and anxiety disorders, bipolar disorder, and anxiety disorders in the general population. Well, Dr. Kessler has conducted a most remarkable study that relates to foster care, and I'd like to describe it to you today. As many of you know, there's lots of controversy about foster care in the United States. Children are removed largely by the court for good reasons, and they're placed in foster care, long-term foster care, usually removed as younger children or adolescents. And there are both publicly funded foster care systems, but a remarkable experiment was conducted in Oregon and Washington by the Casey Foundation. The Casey Foundation set up a private foster care system in which they were able to provide considerably more resources than was available in the public foster care system. And now what Dr. Kessler has done is compared the outcome of those individuals placed in this private foster care system and compare it with the outcome of those individuals placed in the public foster care system. And the results are quite striking. This is not meant in any way to be a criticism of the public foster care system. Everyone knows that it's under-resourced. In the Casey private foster care system, the caseworkers are more highly educated, they have a smaller caseload, and that there are certain benefits to the families that take on these individuals as foster children. Namely, there's a higher stipend per child. And in addition, the children are guaranteed a college education at the college of their choice, in addition to a number of other benefits. As many of you know, I have conducted considerable research that have shown that early life experience has a tremendous impact on vulnerability to mood and anxiety disorders in adulthood. And we know that child abuse and neglect in particular markedly increases risk for depression and anxiety in adulthood. So there were 111 children and adolescents placed in the private Casey foster care system and 368 in the public system in Oregon and Washington. And the results were very striking. Those individuals placed in the Casey private foster care system had much better outcomes. They had much lower rates of substance abuse and alcoholism. They had much lower rates of adult psychiatric disorders. By and large, they had much lower rates of medical illnesses, and they had much better outcomes in terms of them going on to college and being gainfully employed. There shouldn't be anything too surprising about this. This is, if you will, almost an extension of the Head Start data in which early intervention in a positive way has an important beneficial effect. But I think it is important for us to be able to actually see these data in real life and understand that children and adolescents taken out of, unfortunately, abusive and neglectful environments and placed into foster care, which is the very best care that can be had, end up with really better outcomes from both a psychiatric and medical vantage point. And that's important, and we should use these data to go on to model our public foster care systems as well. I hope this has been of interest to you, Thanks for joining me today on Medscape.